Welcome to Undiet Your Coaching Practice podcast. I'm Stephanie Dozier, clinical nutritionist, certified intuitive eating counselor, and creator of the Going to Beyond the Food method. And after a 25-year dieting career, I decided to say hell no to diet culture and undiet my life, which also included my coaching practice. I'm on a mission to help all coaches undiet not only their life, but their coaching business. If you want to throw down diet culture, you're in the right place. Let's do this. Hello, my dear colleagues, and welcome back to the Undiet Your Coaching Practice podcast. Episode 43. Today's episode is a treat. It's actually an extract from our non-diet coach training week event that is happening right now. So if you're not part of this event, you should be in. We've put the link in the show note. It's $47 to join us, and we have training going on right now in a big intensive. I say big, it's because it's 5 days in a row. Starting on May the 9th, we're going to spend an hour together every day, and I'm going to coach you on the 4 simple steps for you to have more paying client in your non-diet coaching business. And while we wait for this event to unfold, to happen, from the time you join to May the 9th when we start, we have all kinds of training, bonus training, and this was one of them. One of the questions that this training answer is the difference between coaching and therapy and consulting. And I decided to pick this question from all the questions that were submitted because that's the one that I see has the most power over coaches. And I call it the, quote, out of scope drama. Coaches, first of all, here's the thing, and you'll learn that in this episode, coaching is not consulting. And it's important that you understand the difference because there's a lot of coaches who think they're coaching, but they're actually consulting. So be sure to listen to that. And I talk about this right at the forefront of the training. But when we get past that, coaches are afraid. Some coaches, not all of you, some coaches are afraid of going in deep and helping their clients with food and body image because they're afraid they're going to be out of scope and they're going to be doing therapy. So what I did is I actually asked 3 of my students that have graduated from past cohort of the non-diet mentorship program to come and have a panel discussion on this. And these students are therapists. We've got people from all various backgrounds in the non-diet mentorship program. And we have a lot of therapists, social worker, mental health counselor, and 3 of them came on to the podcast. And we hosted this panel conversation about therapy, coaching, and consulting that I'm going to share with you. I'm a consultant from training, so I hosted the role of consultant, which now transitioned over the last 5 years to coaching. And my students are actually doing therapy and now coaching. So like they're expert in understanding the difference. So I wanted to bring this conversation to the podcast in case you're not joining us inside of the non-diet coach training so that you can understand better the difference and go all in with your client in coaching them out of diet culture. Because intuitive eating and body image coaching, it is not intellectual. You have to embody it, and your client have to embody it. And the only way we can get our client to embody intuitive eating and body image is through coaching. So, without any further ado, our podcast team is going to roll in the exact recording. We didn't edit it at all. We're going to show it to you exactly how it happened. And hopefully you can come and join us in a non-diet coach training week. So welcome everyone. So there's people live everywhere. So we have people live on Facebook. You have people live in the Zoom room. And we're going to be recording that for the podcast as well. So I want to welcome everyone, wherever you are in space and time or in physicality. I welcome all of you. I have been wanting to have this conversation on consulting versus coaching versus therapy for a long time. It's been brewing for a long time. And it's going to happen today because I found some people who were as excited as me as to have this conversation with me. So I brought them in together. This is not a type of training session where you will find the right way and the wrong way, because there's no such thing in this context. That's why this is a panel conversation where you can hear 4 different brains conversing and sharing their opinion on a topic that you can then extract what fits you well and then create your own point of view and perspective on this. So to this panel, I would like to welcome Jen. Jen is a social worker, Korean American therapist, an intuitive eating coach, body image coach, and she's a graduate of our mentorship program. So she does both coaching and therapy. Is that correct, Jen? Then we have Vanessa Preston. Vanessa is a therapist, a nutritionist, a body image coach, an intuitive eating coach. Did I miss anything, Vanessa, to your pedigree? We're good?
No, it's my past imposter syndrome.
So Vanessa does both coaching and therapy, and also has a background as a nutritionist in what I will describe as consulting very shortly. And then we have Sabrina. Sabrina is a therapist, an emotional eating expert. She's got a fantastic podcast that's rocking and rolling on iTunes with that, and a therapist as well, and a coach. And she's a graduate for the non-diet mentorship as well. Welcome, Sabrina.
Thank you.
And then we got myself. I think we all know me. I'm Stephanie. I will be representing the consulting part of this conversation because I've done consulting for 4 years in clinical nutrition, and also the coaching part of this, which I'm now focused on. So before we start opening the conversation in the panel, I wanted to be clear on our objective today. The number one objective of this conversation is to eliminate the mental drama that many of us have around being out of scope. And I say us, I am talking to a very niche group of people who coach in a non-diet culture approach within their sphere, right? So I get a lot of question and concern around, well, how can I know I'm not out of scope? So that's the goal of this conversation, is to help you get clarity around that, and also decide who you are, and not try to be everything, but to know who you are, what you are best suited for, what you are qualified also to do, and then to be the most powerful version of that, because you're going to own yourself. To do that, we must first understand the difference between consulting, between therapy, and between coaching. And understand there is a time for each one of those, where in a client's journey is the best time. And also, in order for us to be the best version of the one thing we are, also how to develop a referral network. So with that in mind, let's start with consulting. I want to get this out of the way. Consulting is a process that involves providing expertise to a client regarding their goal. So a consultant will come in to a problematic situation, or to a situation where we need a next level of performance of goal. The consultant is an expert in a narrow portion of the goal, they will help identify, assess the problem, and then provide a solution. They may provide a protocol, a process, tools, trainings. They may facilitate group frameworks, but they will not accompany the person through the process of implementation. They will not provide assistance in embodying the tools and the process. So in our world, this is where clinical nutrition is a perfect example of that. Client will come in with a diagnosis, they will come in with a medical condition, and they want the nutritionist to provide a game plan, a framework around nutrition for their particular condition. So most clinical nutritionists or even medical doctor will not take along the client on the journey. They'll provide the plan and then they walk away. In our world, that could also be the book of intuitive eating. The book of intuitive eating is, here's the 10 process, the 10 steps you must do. Here's what they are. Here's what they look like. Implement it. So anytime you look at a book, at an online course, that's consulting. It's taking a problem, specific plan, going in. Coaching, on the other hand, is to give company in implementing the process. And not by telling the client what to do, but coaching is about pulling the answer from the client. Consultant go in, they tell people what to do. Step 1, 2, 3, 4, 5, 6. A coach develops the client's ability to find their own inner resources along the way in implementing what they need to implement to get to a goal. So often when I train professionals, I say, as a coach, your role is to take a client from point A to point B and helping them along the way to get to their goal, to become an intuitive eater. So as a coach, your role is not to provide them with a 10-point PDF of the 10 principles of intuitive eating. That's a consultant. Your role is to take the PDF with the client and implement it and help them find the answer within themselves as situations come along. At the end of the day, when the client is finished their coaching with you, they should have the inner resources to sustain these new habits or this new goal for the rest of their life. That's what coaching is. It's like riding a bike. The best example is riding a bike. There's a how-to manual on how to ride a bike. And then there's the parent standing behind the child, right? Pushing the bike, picking up the kid, putting it back on the bike, say, you can do this. Let's go along. That's what a coach does. They're the parent behind the bike, not the how-to manual. So that's consulting and that's coaching. Now I'm going to bring the expert in the field that I'm not an expert, which is therapy, and have them tell us how therapy can be defined. Don't be shy. Let's all open our mic and let's just jump in.
Stephanie, when you sent this, I went down a Google online rabbit hole.
Yes.
I was like, and when you said something I've really been thinking about, and it does have to do with this conversation, is we have a binary brain in a complex world. And I think that's true when it comes to trying to define some of this. Like when you were describing consulting, coaching, I kind of almost saw some sort of spectrum or something.
Yes.
Where and then further down is the therapy space. And the thing I find interesting too is that if you had 10 therapists, they're all going to define it differently depending on the training they've had, depending on what kind of framework they work from, right? Are they acceptance commitment therapy? Is it person-centered? Is it cognitive behavioral therapy? But when I think of, well, what is therapy? One is, if we're looking at it from more of a medical model, it is a space with a highly trained, qualified individual to treat things like trauma and mental health disorders. But we can also define therapy further from that kind of pathologizing model where it's a safe space. It's a contained space, and containment with boundaries, with ethics, we're all heavily regulated. And to me, it's kind of walking beside my client, helping them reconnect to their deeper self, understand how they relate to the world, really understand what their values are. And I think Sabrina said this, well, now it's been over a year ago in the mentorship program, but ultimately therapists, we want to outwork the need for us, right? That's kind of how I think of therapy. Yeah,
I say that in all of my intake sessions, whether it's coaching or counseling, more in the counseling, because it's kind of more of a set time limit usually, thanks to insurance, if you're utilizing that, of my job is essentially to work myself out of a job. If I'm doing my job correctly, you don't need to see me every week or every other week. I give you the tools, we practice the tools, we learn the ins and outs of the tools, we learn when to use the tools, we learn why to use the tools, we learn what got us here so we don't go back there. And then after that, you as the client get to be in the driver's seat with that, and you get to utilize those tools. And my job as the counselor or the therapist is to really empower you to believe in yourself that, yes, I can do this on my own. I don't need somebody to hold my hand all the time. And then when big things happen, okay, well then call me. If it overwhelms you again, that's what I'm here for. But we don't need to be getting together every week.
Yeah, and Vanessa, I agree with kind of what you were saying about the broad spectrum. I think that's why I kind of had a brain fart at the beginning, because therapy is for me, it's such an undefined, it is a defined space, but it's also not a defined space. And I also feel like it's depending on who I'm seeing, right? And kind of what they're looking for and what they need. So for me, it's just kind of that really personal journey of getting to know who you are at the core and kind of developing skills. And like you said, to kind of hopefully, so I don't need to see you again in kind of the nicest possible way. Yeah. But it's such a broad spectrum that I feel like therapy can look like so many different things.
Yeah. And I think one thing that you said, Jen, when a few months ago, you said, because you were struggling as a therapist between coaching, because that was the new piece, and then therapy you were really comfortable with. You said something that helped me in this binary approach, which is coaching is in the now and therapy is often in the past.
Yeah.
Right? Therapy goes into, like, I call it, again, I'm simplifying things, but to give you an idea for those listening, therapy is often like you've got a bump on the skin and you need to scratch at it to remove the pus, right? To get it to heal. A coach will not go and scratch there because we're not qualified. We don't understand all the intricity of trauma and all of that. We just move people over the bump, or we refer to go have somebody help there, because that's like things that we don't have the skills to deal with. So when you want to think about the simplify approach, perhaps, does everybody agree? Coaching is more in the now, therapy is more often in the past?
I think, like, because we were messaging a little bit about this, and I think as almost kind of a super general statement, like what you said, if we're really trying to have column A and column B, so we have some structure of understanding of the difference, yes. But to me, therapy is past, present, and future. Whereas I get what you mean, coaching, no, you don't want to kind of dig up childhood traumas.
Look at my face. No.
Like, I'm not here for that, honey. Yeah. And something, Stephanie, you said that I liked was the bike metaphor.
Yeah.
Because when you were describing that, I was like, well, what's the therapist's role?
Yeah.
And
it's
what Jen said of, it's very client centered. So I'm like, honey, do we need a new bike? Do you need to hear that it's not your fault that your dad's not here teaching you? Do we need to do some work that your mom was criticizing you the whole time that you were trying to learn this, how to ride this bike? So I kind of pictured this, like, let's figure out what's needed with this bike riding thing. Yeah. So I like that metaphor.
Yeah. There's 3 people behind the bike. There's the owner, the how-to manual, there's the coach. You can do this. Pick you back up, putting you back on this. And there's the therapist beside. I know, honey, your dad is not here to teach, but that's okay.
Yeah.
We'll help
And
you process.
I would love to hear. Oh yeah, sorry. Go ahead.
No,
Jen.
go ahead. I was going to say we help you process when you've fallen off the bike and like how to get you back on. Right? It's okay that you fell. Let's
the trauma is falling off the bike. We'll help you process the trauma and get over it, right?
Yeah, get back on the bike.
Yeah. No, I was thinking tell me what the 3 of you think, but with therapy, I think too, like I said, it's client centered. So part of what we do at the beginning is a pretty thorough assessment, getting to know the person, and then really going, what sort of space or framework, and we might even contract with the client what's going to suit you best. Whereas, do you think coaches, is it more kind of like, here's the structure I'm working with, and this is how I'm going to sort of walk beside you to go point A to point B? Like, is it more of a...
Well, I would say yes to that in the sense that most coaches own one framework of reference for coaching. They don't have multiple skill sets like therapists have, right? Childhood and family patterns and all of this. Coaches will have one framework to work from, perhaps maybe 2 to refer to, but it's very limited because the goal is not to go and understand the past and how we got here as much as how do we get there to where you want to go in the safest way possible.
Yeah.
That's my point of view.
And I would echo that and add that it's kind of practitioner dependent.
Yeah, true.
Because, if you have people who are duly licensed, or the 3 of us practice therapy as clinical social workers or licensed mental health counselors or whatever else your designation is, and you're also providing coaching, like, we can do the best of both worlds because we have all of that in-depth knowledge and training, and we can also get right to the point in the here and now.
Yes.
Well, and I've always found kind of interesting on the different therapist website that kind of when you list all the different frameworks you can use, coaching is always kind of one of the different frameworks that you can use. So I just feel like it's all part of a toolbox, just depending. And I think that's client centered, right? Like, I know I have certain clients who want more of a coaching, like, I'm at this transition point in my life, help me get through it, versus, I'm trying to process this to kind of move forward. So I think it's very client centered.
And I think also because of the intention behind hiring coach, which is to get from point A to point B, versus therapy, which is to heal, process, come to peace with something. I think the how can I say that? The way to get there is, I don't want to say simplified, but it doesn't require as much understanding of all the things that impact the human being, like trauma and family units and so forth. And the individual can go get that on its own, but we're still not, as coaches, educated enough, skilled to go and help with classified disorder. So I want to get that on the table. Like one of the things I'm adamant with when we're talking about that non-diet coaches is that we're not qualified to work with eating disorder, for an example, right? Because the complexity as to how the eating disorder got to be, what's sitting below it, if that's a viewpoint, what's sitting below it is complex. Mm-hmm. So as a coach working with me, like when we're talking about out of scope, working with eating disorder, that's an out of scope situation. Would you agree to that?
Most definitely. And another like simplified way to think of this is counseling takes you from bad to good. That's when we're like in the trauma, we haven't really healed from it. It's that wound that festers. And then coaching takes us from good to great. Mm. And that we've done, if we've healed all the trauma, if we worked through all the things in the past with counseling or on our own, then the wound is kind of healed. It might have a little scab, might have a little scar, but then coaching comes in and we can do some massaging of the scar so we can break up some of the scar tissue and maybe put on some cream and fade the scar.
Yeah. I like that.
Anyone else wants to comment on this? So let's talk about how to scope overall. So the main concern that I hear, and it's a question that got posed by health professionals. So let's take the example of a dietitian, a nutritionist who fear that coaching their client will lead them to work out of scope. Somebody said something in the pre-conversation we had here, and I think it's Vanessa, says we can't coach without thoughts, feelings, or body sensation. Do you remember saying that, Vanessa?
Mm-hmm. Yeah.
So how do we reconcile this fear of out of scope and walking that boundary between coaching and therapy, yet still talking about thoughts, feelings, and body sensation without falling into therapy? It's a complicated question that does not have a defined answer. I'm telling you, this is just conversation.
I think one from a super practical standpoint is whatever assessment is done at the beginning of the engagement for service, right? That's just a really practical way. So do you have some sort of assessment in place where you are going to catch it more at the beginning that this person potentially has a mental health disorder that's having a real impact on their work, their lives, their relationships? Is there unprocessed trauma that needs process, right? And I know these are like complex things, but some sort of assessment that lets the coach know kind of what Sabrina was saying. Is this person in a good, stable place to take part in this intervention, right? So kind of catching it early.
Yeah.
I agree with that, Vanessa. And in sort of that assessment process or earlier on, really having some good questions that will help you sort of dig out, is this person, especially working in the non-diet space, is this person actively in an eating disorder?
Yes.
Because people will come to you and they will say, oh, I had this eating disorder. Oh, I was an emotional eater. Okay, have you had any formal treatment? Where are you getting, like, were you diagnosed with that? Because if they're still actively in that eating disorder, and it doesn't matter what eating disorder it is, eating disorders is one of the leading causes of mental health death in the world right now. And so it is a very serious thing. And I think there's a lot of misconceptions too, that if a person has anorexia or they're in a smaller body, that they're more at risk. But that's not true. We can have larger bodies and still suffer from that malnourishment if we're not eating enough. Mm-hmm. And I think that's where some of this scope comes in of like, yeah, we need to make sure that we're doing the best for our clients and not getting them into a situation that could potentially be hazardous to them.
Yeah. I would agree. And, I would encourage people to not be afraid to ask those questions, right? Because asking the questions does not necessarily mean you're giving treatment, right? This is kind of my intake, my assessment to figure out if this is a good spot for you. I feel like if you get nervous to answer those questions and you kind of hesitate and kind of dance around it, it makes it awkward. It can feel very uncomfortable on both parts. So, just to remember, it's not treatment to just ask the questions in an assessment.
Yeah.
And I think the word treatment is key also if you want to define the difference between therapy and coaching. Mm-hmm. Coaching is not treatment of any kind of condition. It's an accompaniment, it's a journey together, but we're not treating anything. If the person requires treatment for depression, anxiety, eating disorder, whatever the treatments require, we coaches are not equipped for that, nor our consultant. Mm-hmm. That's when we refer out. Mm-hmm. Somebody said in the thread also as we were preparing for this, and I want to bring this up, for any coaches or consultants that is asking the question, is coaching out of scope? And am I working from out of scope? Somebody said, if you're asking the question in itself, I think it's Vanessa said that, if you're asking the question, if you're concerned with being out of scope, it's probably that you're not out of scope. You want to elaborate on that?
Yes, I think if someone is reflective enough to be checking in as a practice, am I in or out of scope? The likelihood is you're not out of scope, because to be honest, the coaches who sadly are doing some damage and are out of scope, they're not walking around and reflecting going, is this out of scope? They're doing the damage without knowing. And when it comes to this question too, I know anybody who knows me already, curiosity, right? Because it's kind of just coming back to that curious, reflective space. If you've had that question come up in an interaction with a client, it's more stay with the curiosity, maybe reaching out to a colleague. In the therapy world, we have mandatory supervision. So kind of reaching out to someone potentially with more experience than you and just talking through it. So this is an ongoing reflection in your coaching practice, this question. And sometimes it probably is coming from a place of what Sabrina was talking about. Okay, now I'm realizing this person is much more in their eating disorder than even maybe they realized. Let's get a therapist involved to collaborate. That's one of my favorite things. It doesn't have to be either or. They can complement each other really well. But this out of scope question also could be coming up because the person, the coach, feels uncomfortable with the content that's come up, with the emotion that's come up, or with the body sensation that's come up. And so it's kind of this reflection needed. Maybe there's merit and I need some extra support for this team to support this client. But also maybe this is my own, are we allowed to swear on Facebook Live? I don't know. Maybe this is my own stuff, my own discomfort. And that's something also to unpack. Right.
Brilliant that you opened that door, because I wanted to open that door. My experience has been that often when I become the coach of that coach and we start doing the work and they are afraid of being out of scope, it's not because they're out of scope. It's because they themselves as the coach are uncomfortable talking about thoughts, feelings, and bodily sensation, and they're transferring or thinking of that, well, I must be out of scope. Mm. In my opinion, you're not out of scope. You just need to improve or upgrade your own personal skill set, and then you'll be able to work at that level with the client. What do you guys think of that? Are you all shaking your heads? So you all have a lot to say. So somebody gets us started.
What I've noticed a lot being in both the coaching and the counseling world, and it doesn't matter what your designation is, there's a lot of discomfort with emotions, and there's still this idea that emotions are polarized or binary of good, bad, positive, or negative. Friends, emotions are just emotions. They're neutral. They don't have any moral value. It's our perspective that really gives that the moral value. So if you're brought up to think that anger is a bad emotion and you shouldn't feel angry, because every time you ever expressed feeling angry as a kid, you were punished, you're going to grow up to think, oh, I should never feel angry. When I feel angry, I'm a bad person. And when we can let go of that judgment and just really sit with this idea that emotions are just messages from your body, it makes it so much easier to feel the emotions, and it takes all of the fear out of it. Yeah. And then we don't have to go, oh, am I out of scope because I'm feeling an emotion?
Yes.
Right.
Or sorry, Jen, we are just on the same wavelength.
Same minds, right? No, go ahead.
I was going to say something I've heard from coaches is being fearful of triggering someone. And I sometimes think it's actually that, no, it's just this person expressing some maybe heavy emotion. And for the coach, if they have not done their own work around their own nervous system, their own regulation skills, what Sabrina was talking about, what happens for them when certain emotions are brought up, then they're going to mistake their own dysregulation for, again, this thing of maybe I'm out of scope. And it's actually, you might not be out of scope, but it's more, we need to get you some support to sit with this, especially in the body and food stuff. How much sadness and grief and anger come up? How much? And grief can be one of the heaviest, grief and shame to be in the room with. But again, it's not necessarily I've triggered this client out of scope. It's part of the intervention is sitting with that with the client for a moment. And that's not therapy. That's just humanity.
Yes. That's the human skills, just the skill set of being a human, having emotion.
Yeah.
Jen, what did you want it to say?
Yeah, I was actually going to say the same exact thing, and I think it's, when I think about the example of anger, it's, are you getting triggered because you're kind of interpreting anger as bad? So you're feeling kind of your client's anger and interpreting that through your lens. I think, that's kind of, it's how we've been raised. And, I love that now, at least, like I'm looking at my kiddo school and they actually now teach feelings, which I love because, like when I was raised, it was, like, don't stop, don't cry. There's no reason to cry. Right. But now they're kind of saying like, okay, you can cry. Right. That's okay. And that's now the message, but that hasn't been the message until really recently. It was, feelings are these big things that, sometimes require a professional to kind of help with, right? I think that's kind of where some of the scope and out of scope come in. But I mean, feelings are just a part of what we have every day as kind of human beings, right? That's just part of our human experience. So it's about being able to sit with somebody else's emotions without getting, yourself triggered.
It's interesting because as I hear you say, if the individual coach does not have all those skill sets, then coaching their client at that level may be out of scope. Do you know, this is why there's no answer. Like there's a quote that you've heard me say many times, but you can only take your client as far as you've taken yourself. At least as a coach. I'm not sure as a therapist if you have guideline of how much personal work you need to do. But as a coach, I know I can deal with a lot more just because of my lived experience and how much work I've done than a coach who started coaching a year ago. Just because of the nature of how comfortable I am with my lived experience in certain parts. One of the questions I ask, and I don't know if I have the answer for, I know as coaches, we can only take our client as far as we've gone. Is it the same thing for therapists?
Depends on which therapist you ask. Like, I'm so sorry.
It's okay. Let's go.
You guys should talk to each other offline. You're like your friend without knowing.
We are, yes, honey, we're just in the same. It depends on who you ask, right? Like I've spoken to clinical psychologists who very much stick to kind of a structured, manualized approach, who have never done therapy themselves.
Okay.
But in my opinion, it is imperative for a therapist to have done their own therapy and continuously doing their own kind of personal development, self-development. And that can change: consulting, coaching, therapy, breath work, yoga. It doesn't have to be, but the work on ourselves is very important, as both. This is where it's both, I think, coaches and therapists. And unfortunately, depending on what country you're in, I know that takes a level of privilege, which is just a whole nother conversation. But I don't think we can support someone's healing in any area if we're not really doing the nitty-gritty healing ourselves.
Ongoing. Right. I'm going to get back to you, Jen, on that. But one other thing that I started to implement, at least in the mentorship program at like level 1, is even if you can't afford to hire your own coach, I'm going to talk for coaches here, buddy up with somebody that uses the same coaching framework than you, authorize each other to coach each other, and then get into a relationship with a coach partner and experience real good coaching from your partner and give it back until you can have enough revenue in your business to hire your coach ongoing and to be coach as you coach other people, which I think is what you say with therapy, right? You go through your own therapy while you provide therapy services.
Yeah. And you're doing kind of routine supervision and peer supervision. That's how I translate it to the therapy world. What you just described: get together with a coach, with a friend, kind of really hold each other accountable. It's similar to peer supervision in the therapy world.
What did you want it to add, Jen?
Well, I love that the coaching model. No, I was just going to say there are actually some training programs, like master's level, PhD level programs, that actually require you to be in therapy while you're in that program. So yeah, I think that is kind of that kind of idea. And it kind of makes me think of, marketing, right? We're selling ourselves as a coach. We are the product, right? So I kind of feel like if we're not doing that work ourselves of kind of healing and holding and kind of working with our thoughts and feelings, like that comes through in kind of how we're marketing ourselves as coaches, right?
So I'm going to close this out of scope question with kind of 2 takeaway. Number 1, the discomfort you feel or the fear you feel in being out of scope may be present because of your own limitation with your own inner world management, right? Your thoughts and your emotion and your bodily sensation. So you may think you're out of scope just because you're lacking the skill set. And then 2, if you're worried about being out of scope, you're probably not being out of scope because you're thinking of your client first. Is that correct?
Yeah.
Okay. So let's talk about specifically intuitive eating and body image. Somebody asked a question here. I'm just going to go to this question because it's repeated twice now. Then there are coaches who have counseling background, but do not want to do counseling anymore and stay away from it. What do you guys have to say on that?
I've seen it from different levels. There were quite a few people who I went to school with in my master's program who, for whatever reasons, didn't want to go on and continue with the licensure requirements in their states, or like the testing requirements, for whatever reason, test anxiety, doesn't matter, that then chose to, okay, I have all this background, I'm going to do coaching. Great. And I think that the licensing piece and all of the regulations that go into the therapy counseling world does deter some of the people from entering it or staying in it. And also my mentality on that is, okay, that's how we're keeping our clients as safe as we can. is we have all these checks and balances to make sure that the people who were providing that care, that treatment, are up to snuff.
Sure. Anyone else wants to comment on that?
Yeah, I kind of thought the same as similar
Yeah.
to Sabrina, because I don't know how you separate some of the counseling skills from the coaching space. I think it's more maybe the systemic stuff of you can work across state lines. You're not held as kind of all the licensing stuff that Sabrina just said can be a lot of work.
And there's also the limitation when you take insurance versus private care. And it's also like, let's call a spade. Counseling and therapy can be heavy.
Yeah.
Right? Like if you don't have the right regulation in your nervous system, you don't take care of yourself, you can take on a lot of the stuff in a counseling session. And that it's like massage therapists, right? If they don't use their body right, after 5 to 10 years, they can't do massage anymore. So I'm assuming, would it be the same with counselor? Like if you don't manage yourself properly, you get exhausted at the end of counseling? Like,
yeah.
Burnout is definitely a thing.
Yeah.
And that it is a really good skill to learn, whether you're in coaching or counseling, is learning how to shut it off at the door. I know throughout the time that I've spent with you, Stephanie, one of the things that always sticks with me is how you say it. Once we're done with your coaching session, I close it. I don't remember what we talked about. That's your stuff to remember.
It is true, people.
But that's also really good self-care on your part, because it's not your stuff. You don't need to take my stuff home with you. No, that's mine. That's for me to sit with and work through.
Yeah.
One of my favorite questions is, does this belong to me? It's one of my favorite questions, not just in coaching therapy, but does this belong to me? Often it doesn't.
Yeah. One of the things that's guiding, so one of the reasons why I got there, where like I can coach you intensely, and then when I'm done, I have limited remembrance as to what we coach, is because I truly believe at the bottom of my DNA that thoughts have no moral value and feeling are just sensation passing through your body. Right? So I believe it to my core. So I know that what you're experiencing is just temporarily, and I'm coaching you through it, and you're going to move through it. Like, I know you're not going to stay with it. Okay. So let's talk about specifically intuitive eating and body image. The reason why I want to specifically narrow down to our niche when it comes to coaching and therapy is because I see many people who call themselves coaches who approach intuitive eating and body image from a consulting standpoint. And here's my opinion, my big, bold opinion here. You will never heal from body image and intuitive eating from an intellectual perspective. That's me, 6 years of coaching on that say this. Stimulating consulting and only stimulating the intellectual part of your client will never result in full healing. What is the therapist angle on this?
I completely agree on that. And there are those really special unicorns that you can give them the intellectual material, and they will go home and they will sit with it and they will feel all the feelings that come up with it and they will work through it. But they're unicorns. These people do not exist for most of us. And so in order to really do that inner work, that inner healing with body and food, we really need to have somebody holding our hands or walking along the path with us. It also really helps to speed up the process. Not that we're trying to rush through it, but if you're trying to do it on your own and you're just reading a book here and there or doing a workbook, there's so many thoughts, at least for me, that came up of oh my gosh, am I doing this right? Is it totally normal for me to be feeling like this? Or should I have it all figured out by now? And having somebody, because I didn't have coaching to go through and with my journey. And had I had somebody, it wouldn't have taken me as long as it did, because it would have been so nice for somebody to just say, yeah, Sabrina, that's completely normal. It makes total sense why you're still here. Okay.
It's funny, as we're talking about this, I'm just thinking about a conversation I had actually about the same exact thing, where she's like, I read all the books, right? Like, I know all the stuff. Like, in my head, I could spew out exactly all of the 10 principles and tell you what they are. But in all the years I've been trying, I just can't get it to stick, right? So like the intellect is all there, right? And the will, well, I don't like using that word, but the want was there, but it was a couple missing connections, right? And as soon as I brought one up, she's like, oh, that makes so much sense, right? So it's kind of about making those connections and kind of figuring out some of those missing gaps. I think is super helpful, both from a coaching and a therapeutic, lens. I think they can be both done complementarily. Is that the word?
Jen, you'd be proud of me. I almost talked at the same time as you again, and I didn't. I was like, no, I'm going to let her scream light up. Be quiet, Vanessa.
It's okay. You can talk over me anytime.
I think I 100% agree with your bold statement, Stephanie, because diet culture has us, I know you say this all the time, has us living from the neck up. We are so disconnected from our bodies, from our inner wisdom, from our inner knowing, that there's no way that the really meaningful body image and intuitive eating work can happen without dropping into our bodies and emotions, not just an intellectual kind of process. And something I love seeing, this is like one of the most rewarding parts, when someone knows something in their head, but they don't know it in their bodies or hearts. That's so common. How many people have said that to you all? I know all the things. I've read all the books. I know, but they're not embodying the work. Mm-hmm. And so it's rewarding when you see their head and their heart align and they're like, oh, now I get it. I've known this for years, but now I like really get it, and just staying in our heads for an intellectual process is not going to get us there. In fact, that can be emotional avoidance.
Yeah.
Vanessa, that's so good. And that's where I think that coaching and counseling piece comes in, because it's really scary. If we've been living up here in the cognitive realm for most of our lives, it's really scary to think about that embodiment or being in our body, because every time we've tried, something quotes bad has happened and we haven't felt comfortable, and we've associated embodiment with discomfort or trauma. Mm-hmm. And having that guide next to you, whether it's the coach or the counselor, to sit with you and be like, yeah, it's totally normal that you're scared stuffless.
Yeah. And starting that embodiment, is small. I like to say meet the client where they are. So some of my clients, it's just every time they walk through a doorway, they take a deep breath, or they just notice their thumb, kind of like a safe, neutral body part. I'm just going to notice the sensation of moving my thumb. So I could go on. I'm going to be quiet, Stephanie, because I could just go on a whole thing about embodiment.
No, go on, because I think I'm serious, because I think I get it. It's the key to therapy is embodiment, but I'm fully there with coaches as well. Like, you can only take your client as far as you've gone yourself. And if you are not embodying yourself, your own life, your own business, this is why I'm so much on the thread of business and thoughts and feelings right now, because I think it's the perfect playground for a coach to see how much embodiment they have. And looking at their business, like, are they paralyzed and frozen when they look at their business, or are they able to process the discomfort in their business? And what I find is, if they haven't done the work with body image and intuitive eating at the embodiment level, it will perpetuate in the business. Is that what you see as well?
It'll perpetuate in the business, or it will show up as fear or anxiety when they're with a client, like we've talked about. Do you remember, Stephanie, in the mentorship program, I had done lots of therapy and work up to that point, but do you remember how many times I froze when you suggested a business idea? I would just be, Vanessa has left the building. Like, I can't even, and so that's the embodiment, is sitting with that, right, with a safe person like me and you in those sessions, and again, staying curious about it, feeling it, and moving through it yourself, because like we're saying, otherwise it's going to show up in your business, or it's going to show up in your hesitation to move with a client in a way that they might need you to.
Yeah. So when you say, let's explore that, I want to put this on record. What does it mean to be a safe person as a coach or a therapist?
It is such a good question. For me, a safe person, to me, it's a safe space. Mm-hmm. So I'm going to believe your lived experience. Not that we can't challenge the thinking behind it and some of what we're creating, but at the end of the day, I am going to believe your lived experience when you express it. I'm going to meet you with empathy and compassion. And I like to think of it as like, when you're growing up, you have a teacher who all the kids love and respect, but they also have some boundaries. Like I like to think of it like that, of, I'm going to meet you with those things. I'm going to believe you, but you might feel uncomfortable in parts of this too. So there's a difference between really feeling unsafe or feeling uncomfortable.
Yeah. Anyone else wants to add to that?
I was just going to say, and that can be anybody can have that skill set, right? Yes. Like you don't need a special training to do it. I'm kind of the mind, if my kid wants to have a tantrum, right? Like you can have a safe space, right? Just don't hurt me, hurt things around, break things. That's fine. But you can have your like space to do that. And then once you're done, let's process it. So like, I think that is something you don't need training to do, right? It's kind of tapping into your human empathy and kind of letting it grow from there.
So a great example of that is when you coach and you talk about body image, it is guaranteed at some point people are going to cry. Mm-hmm. How do you handle that as a coach? Will determine if you are safe or not, right? When the client cries and then you react, then you're likely not safe for them. Am I correct?
Especially if you pull them back into the intellectualizing it.
So talk about that.
A way to acknowledge, like if a person cries, and how often is it about a parent, especially we're working with women, lots of us, it's mom and grandma often who have unfortunately had this legacy of diet culture and all of that. But it can be as simple as a statement of validation. And I don't know what it sounds like to coaches, but something like we're noticing sadness together. Yeah. It's okay for you to cry in here. This is really normal. Yeah. This is painful right now. So you're kind of making a statement of validation, but you don't have to dive in about, okay, tell me about your attachment with mom from 0 to 5.
That's therapy, people.
But it's just a statement of acknowledgement and validation. And that's going to teach your client, okay, it's safe to be emotional with this person. Mm-hmm. Whereas if we go, but what thoughts are there right now? We've pulled them out of the body back into their heads. Yeah. And we need to do that, but there needs to be a bit of space first.
Yeah. Mm-hmm. What about the response? I'll see what you guys answer. Client starts crying when we talk about body image, and then coaches makes faces. Oh my God, I'm so sad. I'm so sorry I asked this question. I'm so sorry I made you cry. Is that a good answer?
No, that's the coach jumping in as rescuer, and that's not our job.
That's a good analogy.
I think also it kind of reinforces that there's something bad about their response, right? Like, oh, I'm so sorry that happened. Like that might be my response because I didn't want to make you cry, but then it can be heard as, oh, I did something that I shouldn't have done, right?
Or crying is not good.
Yeah. That's not an appropriate response.
But when I became good with crying? When I learned to cry myself.
Yeah, Stephanie. Yeah.
When I unshame my own crying, and I'm like, oh, that's my body talking to me. We're just hitting something real hard. And I coach myself through that, and my therapist walk myself through that. I'm like, oh, crying is like nothing. It's just like, it's a sign. Okay, good. Now I'm good with people crying with me because I'm not shaming myself when I'm crying.
And Stephanie, what I think people find too is if there's that space to cry, well, that is stress hormones leaving the body. It's emotions being processed. And usually people can organically kind of then start making sense of their experience, whether that's kind of reasoning or problem solving. But without that space, you're likely working with a less regulated nervous system, and the thought work, it's going to be harder. Just
so putting that space in between the next coaching question, but just that's something I do without knowing I had to do it, but just let's be silent for a moment and let's just cry for a moment.
Yes. Don't be scared of silence, and taking a deep breath as the clinician, coach, therapist,
nutritionist,
dietitian, just taking a breath yourself, kind of making space for what came up.
Good. We're coming up to the hour. So I want to give each one of you the time to say what perhaps hasn't been said, but was on your list of things you wanted to share. Any closing thoughts to the coaches listening who came to this training with the fear of being out of scope? What would you leave them with?
This has kind of been a theme for the last couple weeks with both my coaching clients and my counseling clients, is that this idea that how a person behaves or how a person responds says more about them than it does you. And vice versa, how you respond and how you behave has more to say about you than it does another person. So if a kind of going back to that scenario of I made my client cry, well, I didn't make my client cry at all. And if I respond very intensely of like, oh gosh, I'm so sorry, that says more about me and my own confidence as a coach and my own comfortability with emotions than it does about my client.
Yeah. Good point. Vanessa and then Jim. I'm going to give you guys the go ahead.
You're giving us some structure.
Yeah. Left to right.
Well, I think first, if there's a coach inquiring about this, like I said earlier, or in your mentorship program or listening to this, it's a good sign they're already engaging in a reflective practice, and likely not all the time, but less likely to go outside of their scope of practice anyway. The other thing that I would leave coaches with is rigidity is a red flag. And so if you find yourself kind of up in that binary brain place, this is good, this is bad, this is either or kind of place, just come back and be curious, because even some of what we're talking about there, unfortunately, is not a real solid, this is exactly how you know coaching and this is exactly how you know it's therapy. There's guidelines. But it's more curiosity when it comes up, and then having somewhere to speak through it. Like I said, to then go, is my next point of call a referral? Or is it, I need to practice sitting with hard emotions?
Yeah. Jen?
I guess my parting thought will be to not fear the feelings, right? I think a lot of times we kind of think of feelings as this big, almost mystical thing, but they're part of our human existence, right? It is what makes us human. And I think if we enter the relationship as kind of one human to another, that's kind of a really great place to start. And if you have questions, I like what Vanessa was saying about being curious. Ask the questions, right? That's the best way to kind of find those boundaries for yourself, is to be curious, ask those questions, and kind of learn as we go along.
Yeah.
Can I add one more thing, Stephanie? Because I meant to say it earlier. You also don't have to work with every client that comes through your door. So that is a boundary and something to reflect on too. There might be certain client presentations where you kind of do go, I'm not the best person for this. I kind of had a general rule as my daughter grew up. I generally wouldn't work with kids her age. So you also can empower yourself to really know what's my ideal client And you can say no.
Mm-hmm.
And this is where the referral network comes in.
Yeah. Yeah.
Right? We are professional. We should have a referral network. We should meet with people either locally or digitally, depending where your business is, and create a referral network with therapists, creating a partnership, making sure that they're aligned with your values and what you're teaching. They refer, you refer. And also for you to coach people in a space where you're not comfortable. So for an example, if you're a thin person and a person in a large body comes to you and you're not comfortable coaching them through body image specifically, like I can deal with intuitive eating, but body image, I can't. Then you refer out to a coach, a therapist that lives and owns this identity. And then you do that part of work that you're comfortable with, and then you refer out to another one. So build a large network of people you can refer out to. Thank you very much for your presence here today, and also for sharing your wisdom with everybody listening to the podcast.
Thank you for
inviting us.
Thank you.
You get it now. Diet culture sucks, and you want to stop promoting diet culture and be the cause of your clients' or patients' distress. You want to do what's right for your people, and you know it first starts with you. And that's awesome. And we have a program to help you just do this and reach your business goals. The Non-Diet Mentorship Program is an epic coaching container I created exclusively designed for health entrepreneur, coaches, or professional mastering their own journey with diet culture, food, and body image, while also learning to build and grow their business with ethics so they have a massive impact. And our next cohort will begin July 4th, 2022. Our program is by application only through our waitlist, as we only accept a maximum of 30 students per cohort. You can find the detail at stephaniedodier.com/mentorship or using the links in the show notes. Maybe I'll see you on the other side. Ready to shed diet culture from your practice and help more clients do the same? Awesome. We've got free resources to get you started. Simply go to stephaniedodier.com/pro series, all in one word, and access our 3 free training classes that are currently available. We also have a free PDF guide to intuitive eating, an article about the non-diet approach. We also offer a variety of paid programs throughout the year to support you in your journey to undiet your coaching practice. Join us at stephaniedodier.com/pro series, and I'll see you on the other side.